These are the recordings for Chapter 8, Part A slides, and Chapter 8 is on joints. Let's see, sorry. We covered most of Part A in class, especially what was important. Here we go. All right, so I'm just going to really review. Make sure that you are familiar, make sure you know the word articulation means joint, and make sure that you are familiar with examples of the three structural types of joints. So for the fibrous joints, we'll come back to that. For the fibrous joints, we said that examples would be the sutures of the skull and the gonthoses where the teeth sockets. Syndesmoses are also examples, but I said I wouldn't ask you about those. So I wanted you to make sure you knew that fibrous joints, when they're classified as fibrous joints, that fibrous joints can be the sutures of the skull and gonthoses, which are where the teeth join into their, or where they fit into their sockets. Then when we look at the functional classifications of joints based on degree of movement, there's three. There's synarthroses, which are immovable, and the sutures of the skull are examples of synarthroses. Amphiarthroses, which are slightly movable. These two, synarthroses and amphiarthroses, can either be fibrous or cartilaginous, okay? But the diarthroses can only be synovial membranes. So diarthroses are freely movable joints, and they are always synovial joints. So diarthroses means freely movable. Synovial is the structural design of the freely movable joints. They always have a synovial membrane and a synovial cavity. So diarthroses and synovial always go hand in hand, okay? So now let's look at cartilaginous joints, and there are two types, synchondroses and symphyses. So for the cartilaginous joints, the examples I want you to know are synchondroses. For example, the epiphyseal plate is a synchondrosis, and then where the first rib meets with the manubrium, or the top part of the sternum or breastbone. Okay, those are synchondroses. All of these are immovable or synarthrotic joints. And here you see a picture of both of them. You see the epiphyseal plate here. That's a synchondrosis. And then you see this where the first rib meets with the sternum. That is also a synchondrosis. And both of those synchondroses are cartilaginous joints. And then for a symphysis, that's another example of a cartilaginous joint. A symphysis can be intervertebral disc or intervertebral joints, the joints between the vertebrae, or the pubic symphysis, which is where the pubic bones meet. And here you see a picture. This would be an example of an intervertebral disc and the pubic symphysis where the pubic bones meet. So a symphysis is also a cartilaginous joint, and these are slightly movable or amphiarthrotic joints. So now we move to the synovial joints, and the synovial joints have 6 classifications. Now these are the diarthrotic or freely movable joints. And synovial joints have bursa and tendon sheaths that protect them from friction. They allow for several types of movements, such as circumduction, abduction, adduction. Their stability is influenced by several factors. And they have 6 general features They have cartilage lining the articular surface of their bones. It's called articular cartilage. They have a synovial or joint cavity. They have a joint capsule, which contains an inner membrane called the synovial membrane, which produces synovial fluid. And synovial fluid is for lubrication primarily. It is viscous, meaning it's thick, and it contains hyaluronic acid. So its primary function is for lubrication of the joint and nerves and blood vessels. So here's a picture of a typical synovial joint. You can see the articular cartilage, which is lining both of the bones that meet at that joint. You can see the synovial membrane that produces synovial fluid. And of course, the joint cavity. All right. Sometimes synovial joints will have fat pads for cushioning and meniscus or menisci for stability. So fat pads are for cushioning and meniscus or menisci are for stability. Bursa and tendon sheaths reduce friction, which I already said. And we talked about movements that are allowed by synovial joints. We did this in class, so I'm going to skip over it. Make sure you know the movements, though. Make sure you know, like when you're standing on your toes, that's plantar flexion. When you're rocking back on your heels, it's dorsiflexion. Make sure you can describe the movements. Protraction, your jaw is normal. And then, retraction, your jaw is normal, your mandible is pulled toward your neck, so it's normal basically. Protraction is when you stick it out, you stick your jaw out. So you can see here's retraction, which is just normal jaw position, and then protraction, she's shoving her jaw out like we do sometimes when we're mad about something. And make sure you know elevation, mouth is closed. Elevation of the mandible, mouth is closed. Depression, mouth is open. And then this I didn't get to in class. These are types of synovial joints. A hinge joint, just make sure you know a hinge joint. Examples of hinge joints are the elbow, the knee, and the joints between our phalanges, our finger joints. I was trying to see if that was in the notes, but okay. So I'll just say it as I go through it. Okay. All right, what you're looking at here is what's called a plane joint. I won't ask you about that, but I will expect you to know what a hinge joint is. So a hinge joint allows flexion and extension. And just think about your elbow, okay? Just think about how you can flex and extend your bicep muscle, biceps and triceps actually. So examples of hinge joints are your elbow, the ones between your fingers, interphalangeal joints, and then make sure you also know, even though it's not on here, that the knee is a hinge joint. The knee is a hinge joint. Okay, pivot joints. So the atlas and the axis. So that's going to be like when you shake your head no. That's going to allow for rotation. So here's what I want you to know. For pivot joints, I want you to know that the atlas and axis, when you are shaking your head no, the atlas and axis rotate. Rotation occurs there. And that joint is called the atlantoaxial joint for atlas and axis. That's where the atlas and the axis meet. That's the one I want you to know is the atlantoaxial joint, the joint between the atlas and axis, your first two cervical vertebrae. When you are rotating your head, you're shaking your head no, That is an example of a pivot joint. And then I don't care about that one. Do know that your the joint that forms the thumb joint is called the carpometacarpal joint of the thumb. It's where the wrist bones meet. So it's the joint of your thumb that's closest to your wrist. We would call that the proximal joint of your thumb. Is a saddle joint. Just make sure you know it's a saddle joint. So the bones kind of fit together. There's this would be a convex surface, and this would be a concave surface. So you have a convex and a concave surface that fit together, kind of like a saddle fits on the back of a horse. So example of a saddle joint is the carpometacarpal joints of the thumbs. And saddle joints allow for adduction and abduction and for flexion and extension. Okay. And ball and socket joints, which have the most movement. They're the most freely movable, allow for the most of the joint movements that we went over. One that's not even on here is circumduction. There's a movement called circumduction, which is when you make a circle with your arm. It's not as easy with your hip joint, but you can do circumduction with your hip joint. But the hip and the shoulder joint are ball and socket joints. So those are our two examples of ball and socket joints, and they allow for the greatest degree of movement. They allow for flexion and extension, abduction and adduction, rotation, and also the movement that we went over in class called circumduction. Now we're going to move to, I'm just going to go right straight to our slide set B. From our Moodle course and just go into this material. So slide set B is going to start off by going into detail with some of the synovial joints. So I am going to give you some information about the shoulder joint, the hip joint, and then the knee joint, where I will just focus on those as far as what you need to learn. There is some information in the slides about the TMJ, temporomandibular joint, and that is the jaw. That is the jaw joint. It's where the temporal bone and the mandible meet. It's called TMJ. And the movements that are allowed are hinge and gliding, because you can grind your teeth, and you can depress and elevate, which is really kind of like flexion and extension. But I'm not highlighting any of this because I'm not focusing on TMJ. But there is some information about the condition TMJ. Dislocation of the TMJ is most common because it is a shallow socket. It has a shallow socket. And it can cause ear and face pain, tender muscles, popping sounds, and it's usually caused by grinding the teeth. Now, we're going to talk about the shoulder joint in more detail. The shoulder joint is also called the glenohumeral joint. And the reason is because it is where the humerus bone of the arm meets with the glenoid cavity of the scapula. So glenohumeral joint, that's where the humerus of the arm meets with the scapula at the glenoid cavity. So it is the most freely movable joint in the body, the shoulder joint. You get the greatest degree of movement from the shoulder joint. However, stability is sacrificed. So you get more movement than you do at the hip joint, but you don't have as much stability. So there's going to be probably like more injuries. It is a ball and socket joint. The humerus, the head of the humerus fits into the glenoid cavity of the scapula. And here you can see a picture of the shoulder joint and some of the components. The acromion here that's shown is it's like an upper projection of the scapula, and the coracoacromial ligament is attached to it. Then there is a bursa below that acromion. It's called the subacromial bursa. This is showing you the fibrous layer of the articular capsule. Remember the joint capsule. And then there's a tendon sheath. In addition to bursa, which are packets of synovial fluid that help with reducing friction at the joint, there's also a tendon sheath around the tendon of the biceps brachii muscle. And that is to reduce friction again. Let's see. And there's really nothing else. But this is the head of the humerus, and it's fitting into what you see is the scapula, and this depression that it fits into is called the glenoid cavity. And the animation is on slide number 12 in set B, and I would recommend that you watch it because it helps you understand it a lot better. This image is from a cadaver. So there is the head of the humerus, and then here is the glenoid cavity where it fits into the glenoid cavity of the scapula. And you can see it cut off, but this would be the acromion, the part of the scapula that kind of the upper projection of the scapula. And before I show you the ligaments, I want to find like a better picture that shows you the acromion. Okay, so if you look in the back here, there's two projections of the scapula, and one is called the acromion, and then the one below that is called the coracoid process. So the acromion and the coracoid process are those two projections that kind of stick up. The acromion is higher, it is more superior, and the coracoid process is more inferior. It's a little bit below it. And then here you see the glenoid cavity, and you see the glenoid labrum, which is means lip. So let's go back. The glenoid labrum is a fibrocartilaginous rim around the glenoid cavity, and it helps because it's like a built-up area of fibrocartilage. It builds up the glenoid cavity a little bit more, so it adds depth because it's a shallow cavity. So it makes it less shallow. It makes it deeper. So that's what the purpose is of the glenoid labrum, which means lip. That is like it builds up that cavity with a fibrocartilaginous rim. So it's a fibrocartilaginous rim around the glenoid cavity, like a lip, and it helps add depth to that cavity. There are some ligaments that reinforce the shoulder joint. There's the coracohumeral ligament that helps support the weight of the arm. There's 3 glenohumeral ligaments that strengthen the capsule. And here you can see the acromion, and you can see the coracoid process, and the ligament that connects them is called the coracoacromial ligament. So these are the projections of the scapula. And you can see the coracohumeral ligament that connects the humerus to the coracoid process of the scapula. Okay. The glenoid labrum, the glenohumeral ligaments, which aren't really, you don't have to know them by name, but they just help provide more stability at the shoulder joint. And then you definitely need to know the names of, and you'll need to know this for the next chapter as well. There are the rotator cuff muscles. The rotator cuff muscles. You have to know them for chapter 9. And so there are tendons that connect all 4 rotator cuff muscles to the shoulder joint, at the shoulder joint, to the bones of the shoulder. Okay. So the subscapularis tendon connects the subscapularis muscle to the shoulder bones. The supraspinatus is named for the supraspinatus muscle. The infraspinatus is named for the infraspinatus muscle, and the teres minor is named for the teres minor muscle. So those are the 4 rotator cuff muscles and tendons that surround the shoulder joint. Okay. Now, a common injury to the shoulder joint is a dislocation of the shoulder. And that is because, remember, there's greater mobility in the shoulder joint, but less stability. All right, and then there is a video of the rotator cuff muscles, which is also in the Chapter 9 slides. This is slide number 20. And then I would watch this one. This is slide 22, movement at the glenohumeral joint or the shoulder joint. And then there's another one. I would watch this one too. So slide 22 and 23 and 24. All right, and then there's some information on the elbow joint, which we're going to stop this recording and I'll start back. We'll start back with slide 25 of slide set B.